Put a smile on your face when you're moving from place to place. Good morning.
Welcome back to the morning show on Tobago Updates. I am Adanna Combie. It's currently 7:21 a.m. So if you're making it to work for 8 o'clock, you have 40 minutes in which, well, actually 39 minutes to get there on time. Be safe on the nation's roads. Right, we begin our conversations this morning with our guests in studio. We are speaking to Nicholas Cumberbatch. He is the president of the Trinidad and Tobago Hearing Impaired Association, or Association for the Hearing Impaired, and also Dr. Sidheshwar Pandey, audiologist at the Trinidad and Tobago Association for the Hearing Impaired. And we're speaking about a free hearing screening for our children. Good morning and welcome
Good morning.
to the program. So we're talking about this free screening for hearing assessment. So we want to know, of course, what is this about? Why is it necessary? And how do you know that you should have your child assessed or screened for hearing?
Let Dr. Pandey answer that. Okay, so usually hearing impairment is a very, very silent problem. It's not very visible, okay, like other disability. So especially in the children. So if children born with hearing impaired, it little bit takes time to recognized by the parents. There are few signs like children may not be responsive on sound. Children most probably facing towards your face. Seeing that like they feel that, parents feel that like, oh, the child is hearing. The most common symptoms, they have a delayed speech. So, and as well as unclear speech. So these are the few symptoms. Even in school going children, their scholastic performance usually fair or poor. So in such instance, definitely children should go for the hearing screening, and if they fail, then definitely it will be further complete diagnostic evaluations, because early detections and early intervention is very, very important. As early we can diagnose hearing impaired children, we can provide a better management.
Right. So how early should you send your child for assessment? Because I know you said sometimes it's difficult to detect the hearing issue, especially because a young child can't really communicate verbally. So how do you know, from what age do you recommend or suggest that you should send the child for a screening?
Actually, there's a program called newborn hearing screening program. So the baby, once they're born, newborn baby, definitely they're supposed to go for the hearing screening. That is the first time once they're born. Then further, definitely as early as possible. So definitely once the baby born, they're supposed to go. And then from that, anytime the parents feel that they can, like their child have some issues, definitely they're supposed to go for the screening. So yeah, it's very, very early.
And the reason I asked that is because I had my own personal experience with this. I'm a mother, and I remember when my son was a couple of months old, we were sent to do screening. I didn't identify any issues with his hearing.
Right.
In fact, to me, he was hearing perfectly well. He was responding to songs and commands, and just saying hi, baby, he would respond. But we were sent for screening as well for him, and luckily he turned out to be he passed the screening exam, so he was assessed well. So that's why I was asking, how soon should we send the children? Because the sooner we intervene in these things is the faster we can bring repair or resolution to issues of this nature. That's why I was asking this.
Yeah.
So how this program that we're rolling out in Tobago, what was the genesis or the idea or the purpose behind? How did you come to having to provide this service in Tobago? Because we had to go to Trinidad. The service wasn't available in Tobago. What was the genesis behind providing it in Tobago?
Well, I think what it is, first of all, our organization is called Trinidad and Tobago Association for the Hearing Impaired. And we're established by an act of parliament. So we have serious responsibilities to look after the quality of life of people who have hearing loss, including the deaf and the hard of hearing. Now, admittedly, we are based in Trinidad, and as you said, for most people who need services, they have to take the boat or take the plane to get to Trinidad. Now, we've identified, very recently our organization, we went through some strategic planning, and we have identified certain areas that we need to tighten up on. And one of them is bringing the services to remote areas of Trinidad and also to Tobago. So we made a definite effort. As a matter of fact, early last year, we made an outreach to the THA, and we held a meeting with Dr. Faith B. Israel about this whole, how we can collaborate to get this done in Tobago. We just didn't want to come into Tobago on our own to do this, right? We wanted to do it officially under the collaboration, with the collaboration of the THA. And she was very much interested in what we were saying and what we had to offer. As a result of that, we were here for the first time in June of this year. And I must admit, we had really good responses, because it seems as you said, a lot of people in Tobago have not had this kind of opportunity as much as we would like to have. So we're here again this time, and I think the first time we were here, we were under the guidance of the Division of Health and Wellness. And this time, I think the Division of Education took more or less part of a role in this to ensure that school children are screened, right? So that is our primary effort, a primary concern this time, is the screening of school children, primary school children, secondary school children. So we are hoping that today, which is Thursday, and tomorrow, which is Friday, that a number of people who need screening, if you're a parent, ensure that your child gets to the venue so that they could be screened.
Right, and you said, of course, collaboration is with the Division of Education as well, and they're saying that 324 students from Tobago, primary and secondary schools have already registered for this. So in terms of when you came in June, you said it was highly subscribed because a lot of people came out for screening.
Yes.
So I was about to ask, in fact, and you said it before I asked, in terms of would it be necessary to come again this soon? But I'm seeing that the need is there for the screening to take place. So kudos to the Division of Education and also to the Division of Health, Wellness and Social Protection for partnering with this, the Trinidad and Tobago Association for the Hearing Impaired for this screening. Tell us, Dr. Pandey, what role do you play at the screening?
Okay, so definitely we try to measure their frequency and intensity level, okay, where they can pass, where they can hear normally, okay. It's depend on different kind of audiological instruments as well as the child, what instrument we have to use it, okay. If definitely the child who is very newborn, okay, it's a different instrument for them. That's called otoacoustic emissions and ABRs. And if primary school children, then we usually use a pure tone audiometry screening, and then other tests called tympanometry. So once, let's say once they fail their screening, then we targeted such children, okay, for the complete hearing evaluations. Usually, we have seen that children who fail their hearing screening, most of the times they have congenital hearing impairment. Congenital hearing impairment, that means they're born usually deaf, okay. That is, there's no as such any kind of medical management like medicines which we can provide by the ENT or any other medical doctor to treat it. So that's why then further we'll try to manage with their hearing loss with the hearing aids, as well as some children who is not usually benefited with the hearing aids, then we recommend for cochlear implant.
For, sorry?
cochlear implant.
Right,
Yes.
right. Okay, so it's a very interactive
Yeah.
type of screening
Yeah.
and assessment and resolution, or to this situation. What other services are offered by the Trinidad and Tobago Association for the hearing impaired? Outside of the screening, what else do you offer?
Yeah, well, first of all, in Trinidad, we have 2 schools for the deaf, Cascade School for the Deaf and Audrey Jeffers School for the Deaf. So in other words, we have identified that, children who are deaf and hard of hearing, we need to pay attention to their education and the education process. Now, saying that, recently, we have been looking at other approaches to this. Because on one hand, yes, you can send a deaf child to a deaf school with other deaf children. But there's another thinking that says, maybe, because think about it, some parents only think about when the child is deaf, they only think about their education when they're at primary school level, maybe when they're 5 years old, right? And that is because maybe there are no other opportunities for them to start the education. So the thinking here now is, let us start looking at the education for children from the time they're born, right? Because that is the stage at which you really start being educated.
That's right.
Right? So we shouldn't, the child who is born deaf shouldn't be further disadvantaged by not having that opportunity. Unfortunately, in Trinidad and Tobago, the school system is not equipped or geared in that direction. As a matter of fact, in one of the Joint Select Committee hearings this year, I think Dr. Paul Richards' hearing, it was revealed that even with so many early childhood centers around the country, there's hardly any that accommodate or could accommodate children who are born deaf. So one of the things that we are looking at is training teachers in deaf education, and of course with sign language knowledge, so that, as a matter of fact, we're looking at it as a pilot project, that for now we could probably base it on where people live, the concentration of deaf people in certain areas. Let's say if we take maybe 5 areas in Trinidad, we train about 40 or 20 teachers, and including Tobago too. We'll open it to teachers from Tobago who would like to be part of this program, right? And then we insert them in some of these early childhood centers throughout Trinidad and in Tobago, so that a parent now who has a deaf infant would be able to send that deaf infant to an early childhood center where there is a deaf educator, at least someone who knows education for the deaf, right? And furthermore, language is a funny thing. If it is, think of Spanish. If it is that you grow up learning a certain language, it comes easy. But if you have to learn it when you're an adult or when you're older in life,
More
it's
challenging.
more difficult.
That's
right?
right.
So the thinking is, maybe we could start teaching not just deaf children, but hearing children sign language as we teach them any other language.
So that we can coexist.
Right, so we could coexist. And that is the whole thing. Now, this will take a long time so we could fully understand what we would be doing. But we got to start somewhere. We can't just talk about these things and not do anything.
And the fact that we're starting now is perfect. And we're talking about today and tomorrow. The screening takes place today and tomorrow at the Ann Gift Auditorium at the Scarborough Library today, November 2nd, from 8 a.m. to 2 p.m. So if you have your children registered or whatever the process is, bring them out to have them screened. Also on Friday, 3rd November, which is tomorrow, at the Bell Garden Multipurpose Facility, same time, 8 a.m. to 2 p.m. You can call 787. I'm giving them the information for
yes.
you. 787-8045 for further information or for an appointment. And this is, of course, brought to you by the Division of Health, Wellness and Social Protection, the Division of Education, Research and Technology, and the Trinidad and Tobago Association for the Hearing Impaired. We're doing hearing screening for our students here on the island of Tobago. It is very important, as Dr. said and as Mr. Cumberbatch said, to intercept your children's ability to hear. The earlier the better. That way we can assess them and put them in a position where their learning is not interrupted, even from a very early age, as you said, so that we begin learning from the moment we come out of the womb. We have to adjust to our new environment and stuff like that. So this screening program, of course, is welcomed in Tobago, and we're wondering what is the plans for future events like this. Is there any discussion in terms of having a more permanent arrangement here in Tobago?
Yes. I believe that the THA is really interested in extending this because, you know, somebody was saying, well, why don't we come to Tobago maybe once every 2 weeks or something, at least starting that way. So it means that we have to look at the frequency of it. Of course, it would mean that we would have to employ more people to be able to do this, right? But I wanted to bring up something too. In as much as we talk about education for the child, you know, the parent has a responsibility in all of this as well, right? So therefore, because a lot of parents don't know what to do with these children. And I think if parents could even form some kind of a support group, right? So that they now could be better supportive of their child.
That's right, that's right.
And that is really important.
That's
the
right.
role of the parents in this.
That's right. So we all have a responsibility to ensure that our children are taken care of, that their needs are met, because sometimes they can't communicate their needs where they're at. So we too, as parents, have to take that responsibility. So this screening, it's free screening. Again, let me give you the information. It takes place this Thursday, today, from 8 a.m. to 2 p.m. at the Ann Gift Auditorium at Scarborough Library today, also tomorrow at Bell Garden Multipurpose Facility, 8 a.m. to 2 p.m. Call 787-8045 for an appointment. And of course, this is brought to you by the Division of Health, Wellness and Social Protection, the Division of Education, Research and Technology, and the Trinidad and Tobago Association for the Hearing Impaired. And we have been speaking with Mr. Nicholas Cumberbatch, the president of the TTAH, as well as Dr. Sidheshwar Pandey, audiologist. So, ladies and gentlemen, this is where we end this conversation for today, where we ask, of course, that you continue to stay with us, keep viewing with us, and before we go to a break, of course, we invite you to share the live, share the live, share the live. We'll be back.